A go-to exercise for sciatica relief is usually an extension-based exercise. And in this video, I want to break down the why behind that so you can ultimately decide what is the best movement patterns for your patients or clients that are experiencing sciatica. And then I want to talk about split stance activities and the role and the influence that it can beneficially have on the sciatic nerve, on the pelvis, and overall function for your patients and clients. So we have our pelvis here, and I really want to try to simplify things so we can think of things in two different terms. And those terms are compression or expansion. So at the end of the day, most people that are experiencing sciatica type symptoms are experiencing too much compression. So there's a space issue. So if we fundamentally think about what our jobs as physical therapists are, it is to get them good at what they're bad at. So they are good, or they are in a biased position of too much compression. That compression is pinching on that sciatic nerve as it comes through that lumbar and sacral plexus and goes down the leg. So what we need to do is get them to expand. And this is why a lot of people go to extension-based exercises, but they don't really fundamentally understand what's happening here as we go through extension. A lot of times the focus is at the lumbar spine, and we think about extending the lumbar spine. But what happens is the typical posture of someone that has sciatica type symptoms is going to be more of the tucked under pelvis, the more forward head, rounded posture. And what that does is that pushes the pelvis into a posterior pelvic tilt or sacral counternutation, and it's going to compress. So if you think about my hands being muscle, those muscles are just going to compress. And the tighter and the more pattern and position someone gets, the more they're going to compress and start to have issues with that sciatic nerve. So extension-based exercises, if we start to look at the pelvis, it is going to do just the opposite. It's going to expand posteriorly and compress anteriorly. You are going to have sacral nutation. That sacral nutation is going to push the sacrum anteriorly, and the muscles are going to have to respond by expanding. So instead of just thinking about back extension exercises, start to really understand, how am I influencing and changing the pelvis? This pelvis is really going to be an important factor to get more space so that that sciatic nerve isn't being impinged. So now that we understand that a little bit better, let's look at how split stance exercises can be really beneficial. And I really want to break it down fundamentally and anatomically so that you know how to properly modify it for your patient. If we say that the left side is the problematic piriformis or problematic sciatica side, when you perform a split stance activity, you are going to want to shift towards the problematic side. And a lot of times that can sound like that's the wrong choice, or that's more contraindicated and it's going to actually compress more. But if you watch what happens as you rotate towards that side, you can see how the sacrum is opening up. That sacrum opening up is going to work on expanding the tissue. Remember, we have a compression issue. That compression issue is causing our impinged symptoms on our patient. So we need to expand and compress anteriorly. So what happens is, with shifting activities, we are going to turn towards the problematic side. That problematic side is going to then expand. Think eccentric, think length. All these things that are going to help to create space for that irritated sciatic nerve. So I'm briefly going to demonstrate a standing hip shift. However, this can be done in side lying, this can be done with weights, you can change the intensity. So you need to just find what works best for your patient, but the foundations need to remain the same. What you're searching for specifically in this video is the expansion of that problematic piriformis or sciatica side. So we are looking to hip shift towards that problematic side, and you as the clinician need to determine what's the best way for your patient to do that. Here are the couple principles that I want you to remember as you go through it. So we are working on hip shifting, not to be confused with thoracic rotation, right? A lot of times people get too much of the thoracic in there. So what I'm going to do is, I like to give people a ball between their knees that just helps them understand this true pelvic rotation to help dissociate the pelvis from the thorax a little bit. What we're going to do is we're going to cue our patient to put the ball between their knees, We're going to hinge down. I like holding on to something, just gives our patients a little bit of an anchor point. And then we're just gonna find a neutral pelvis, so not too tucked, not too extended. Once you find that, we're gonna cue to press through the inner heel. So specifically the inner heel, that's gonna help turn a little bit more of the inner thigh and the glute on. Also, we're gonna start to work a little bit of hamstrings. These are the more extending or extensor base muscles that we are looking to recruit. All you're gonna do from here is cue your patient to maintain their position, right? That slight neutral pelvis gets the rib cage to go slightly back. And all you're gonna do is reach the right knee forward and gently draw the left back. What you wanna make sure is that the left doesn't go so far back that the patient actually just kind of sinks into it. You need to think about the right knee going forward and the left knee going gently back. Your patient needs to be aware that they must feel their glute. When you go back into that rotation, if you do it correctly, you'll feel that back pocket area, and that's gonna be that expansion occurring, which will feel like a stretch, and it might be pretty intense in someone that is overly compressed there. So take your time, ease into it, get them comfortable and familiar with, reach the right knee forward and the left slightly back until you feel that back pocket area. Once you feel it, hang there, see if you can go a little bit further, but just work on that true rotation. And these are the kind of foundational principles that we want to carry over as we start to go to more intense exercises. But like I mentioned previously, this is a great way to have functional carryover to gait and walking, which are typically activities that really hurt your sciatica-based patients.